Welcome to this video about senior health. This video will talk about 4 silent skin warning signs of esophageal cancer you should never ignore. Have you ever noticed a sudden change on your skin and brushed it off as aging stress or something harmless only to move on without a second thought? Many people do exactly that because skin feels familiar, visible, and safe. But what if those changes were not cosmetic at all? What if your skin was quietly signaling a deeper problem long before pain, weight loss, or trouble swallowing ever appeared? Here is the urgent truth. Esophageal cancer is one of the most aggressive cancers, and it is often diagnosed late when treatment options are limited and outcomes are poor. What makes this disease especially dangerous is not just how fast it progresses, but how silently it begins. Before classic symptoms like difficulty swallowing or chest discomfort show up, the body may already be sending warnings in unexpected places. One of the most overlooked places is the skin. These early signs are easy to miss, easy to dismiss, and yet critically important. This is where knowledge becomes protection. In this lesson, you will learn how esophageal cancer can reveal itself through specific skin findings, sometimes months before the diagnosis is ever made. These are not random rashes or vague changes. They are medically recognized patterns often driven by paraneoplastic syndromes, where a hidden tumor triggers visible reactions on the skin. Understanding these signs gives you something powerful: time, awareness, and the ability to act before the disease advances further. By the end of this video, you will clearly understand which skin changes deserve attention, why they occur, and how they connect to esophageal cancer. Each section builds on the one before it, guiding you from the basics to the warning signs that matter most. This is not about fear. It is about recognition and early awareness. Stay with this lesson because one of the signs discussed near the end is rare, but when it appears, it carries serious weight. What you learn today could change how you look at your own skin and possibly help you or someone you care about take action sooner rather than later. Number 1, esophageal cancer overview. Esophageal cancer is a disease that begins in the esophagus, the muscular tube that carries food from the mouth down to the stomach. You use this tube every time you swallow, yet most people never think about it until something goes wrong. That is exactly what makes this cancer so dangerous. It grows in a place that feels automatic, silent, and easy to ignore. By the time symptoms force attention, the disease is often already advanced. There are 2 main types of esophageal cancer, and where they form matters. Squamous cell carcinoma usually develops in the upper portion of the esophagus and is more commonly linked to long-term irritation. Adenocarcinoma tends to form in the lower portion near the stomach and has become increasingly common in the United States. These 2 cancers behave differently, but they share one critical trait. They often remain hidden until damage is already underway. What makes esophageal cancer especially serious is its poor overall prognosis when found late. According to U.S. cancer data, survival rates drop sharply once the tumor spreads beyond the esophagus. The reason is simple. The esophagus sits close to vital structures, and once cancer cells move beyond its walls, treatment becomes far more complex. This is why early awareness is not optional. It is essential. Many people believe cancer always announces itself with pain or dramatic symptoms. Esophageal cancer often does the opposite. It whispers instead of shouting. Subtle changes may occur long before swallowing becomes difficult. In some cases, the earliest clues appear far from the chest, showing up on the skin through biological signals triggered by the tumor itself. These signals are easy to overlook if you are not looking for them. Understanding what esophageal cancer is sets the foundation for recognizing how it reveals itself. Once you grasp how quietly it begins and how serious late detection can be, the importance of early warning signs becomes impossible to ignore. But knowing what the cancer is not enough, because the next question is why it develops in the first place. And that leads directly to the risk factors you may be exposed to without realizing it. Number 2, key risk factors. Esophageal cancer rarely appears without warning factors, and many of those risks are part of everyday American life. One of the most important is chronic acid reflux, also known as GERD. When stomach acid repeatedly flows back into the esophagus, it irritates the lining over time. That constant exposure can damage cells and increase the risk of cancer, especially adenocarcinoma. Many people treat reflux as a minor inconvenience, masking it with over-the-counter medication without realizing the long-term costs. Alcohol and tobacco use are two other powerful drivers of risk. Alcohol acts as a chemical irritant, while smoking exposes the esophagus to carcinogens with every swallow of saliva. Together, they create a compounding effect that dramatically raises the likelihood of squamous cell carcinoma. Large U.S. studies have shown that long-term smokers and heavy drinkers face a much higher risk compared to those who avoid both. These habits are common, normalized, and often underestimated. Obesity adds another layer of danger. Excess body weight increases pressure inside the abdomen, making reflux more frequent and more severe. Over time, this environment promotes cellular changes in the lower esophagus. Add in the frequent consumption of highly processed foods and late-night meals, and the damage quietly accelerates. Even something as simple as repeatedly drinking very hot beverages can irritate the esophageal lining and contribute to long-term injury. The good news is that risk factors are not destiny. Many of them are modifiable. Managing reflux early, reducing alcohol intake, quitting smoking, adjusting meal timing, and addressing weight can all lower ongoing irritation. Small changes made consistently can reduce repeated damage to the esophagus and shift risk in a healthier direction. But understanding risk factors alone is still not enough, because even people who feel healthy may already be experiencing subtle warning signs, and those signs often show up in ways you would never expect. Number 3, typical warning symptoms. Esophageal cancer often reveals itself through symptoms that seem mild at first, which is why so many people delay taking them seriously. One of the most common early signs is difficulty swallowing, known medically as dysphagia. It usually begins with solid foods. Meat feels stuck. Bread goes down slowly. You may find yourself drinking more water just to finish a meal. Because this change happens gradually, many people adapt without realizing something is wrong. As the disease progresses, swallowing can become painful. This symptom, called odonophagia, is often described as a burning or pressure sensation in the chest when food passes down. Some people assume it is heartburn or stress. Others blame eating too fast or choosing the wrong foods. In reality, pain during swallowing is a red flag that the esophageal lining may already be inflamed or narrowed by a growing tumor. Another warning sign is regurgitation of undigested food. When a mass begins to block the esophagus, food may not reach the stomach properly. Hours later, it can come back up unchanged. This is not the same as acid reflux. It is a mechanical problem, and it often signals advanced obstruction. Weight loss, chronic coughing after meals, and persistent chest discomfort may follow soon after. What makes these symptoms especially dangerous is how easy they are to rationalize. Many patients recall months of discomfort that they explained away as aging diet or routine reflux. By the time medical care is sought, valuable time has already been lost. Recognizing these warning symptoms early can change the course of the disease. Paying attention to subtle swallowing changes and persistent discomfort creates an opportunity for earlier evaluation and intervention. But even these symptoms are not always the first clue, because in some cases, the body sends signals before swallowing is affected at all, and those signals often appear on the skin in a surprising and powerful way. Number 4, paraneoplastic syndromes explain. Sometimes cancer does not cause damage only where it grows, and this is where paraneoplastic syndromes come into play. These syndromes occur when a tumor releases chemical signals into the bloodstream that affect distant parts of the body. Instead of spreading cancer cells directly, the tumor triggers immune responses and inflammatory reactions that show up elsewhere. This is why the body can reveal cancer before the tumor itself causes obvious local symptoms. In esophageal cancer, paraneoplastic syndromes often involve the immune system. The tumor can stimulate the release of cytokines and growth factors that alter how skin cells grow and behave. These changes are not random. They follow recognizable patterns that physicians have documented for decades. What makes them powerful is timing. These skin changes can appear weeks or even months before swallowing becomes difficult or painful. Many patients describe these signs as confusing rather than alarming. Skin may suddenly thicken, darken, or change texture without itching or pain. Because the changes do not seem dangerous, they are often ignored or treated with creams that never work. In clinical practice, doctors frequently hear patients say they noticed the skin change long before the cancer diagnosis, but never connected the two. Understanding paraneoplastic syndromes shifts how you interpret the body's signals. Instead of viewing the skin as a surface issue, it becomes a window into internal disease. This awareness does not replace medical evaluation, but it helps you recognize when something deserves attention sooner rather than later. The most important takeaway is that these syndromes are not common rashes or cosmetic problems. They are biological messages driven by a hidden tumor. Recognizing this connection prepares you to understand the specific skin findings linked to esophageal cancer. But knowing the concept alone is still not enough, because the next step is learning exactly what these skin signs look like, starting with one of the most common and easily missed changes. Number 5, Skin Sign 1, Malignant Acanthosis nigricans. Malignant acanthosis nigricans is often the first visible skin signal that something serious is happening inside the body. It appears as areas of skin that suddenly become darker, thicker, and velvety in texture. The change is not subtle once it starts. What makes it dangerous is how quickly it can develop. Unlike common pigmentation changes that evolve over years, this form often progresses over weeks or months. The most typical locations are areas where skin naturally folds or rubs together. The neck, underarms, and groin are classic sites. Some people first notice it while looking in the mirror or putting on a necklace. Others feel the texture change before they see the color shift. Because these areas are also common places for benign skin darkening related to weight or insulin resistance, many people assume nothing is wrong. The key difference is speed and severity. In malignant acanthosis, nigricans, the skin thickens rapidly and spreads beyond what feels normal. Dermatology literature has repeatedly shown that when this change appears suddenly in adults without a long history of metabolic disease, it raises concern for an underlying malignancy, including cancers of the gastrointestinal tract, such as esophageal cancer. Clinicians often hear the same story. A patient noticed darkening on the neck, tried new soaps or creams, and ignored it when nothing helped. Months later, swallowing problems appeared, and the connection became clear in hindsight. The skin was not the problem, it was the messenger. The most important response is not panic, but attention. Sudden onset, rapid progression, and unusual texture changes deserve medical evaluation, especially when combined with known risk factors like reflux, smoking, or unexplained weight changes. Recognizing this pattern early creates an opportunity to investigate deeper causes rather than treating the skin alone. But recognizing malignant acanthosis nigricans is still only part of the picture, because there is another related hand finding that often appears alongside it, and it may be even more specific to cancers of the digestive system. Number 6, Skin Sign 2, Tripe palms. Tripe palms are one of the most striking and specific skin findings linked to cancers of the digestive system. The name comes from the resemblance to the thick textured lining of animal stomach tissue. The palms become unusually thick, velvety, and exaggerated in their natural skin lines. Many people notice that their hands suddenly look rougher, shinier, or deeply ridged, even though they have not changed their routine or work habits. What makes tripe palms especially important is how suddenly they appear. This is not gradual wear and tear from manual labor or aging skin. In many cases, the change develops quickly over weeks. Lotion does not help. Scrubbing does not help. The skin feels permanently altered. For someone who uses their hands daily, this change is impossible to ignore, yet it is often misunderstood. Medical research has shown a strong association between tripe palms and gastrointestinal cancers, including esophageal and stomach cancer. In clinical reports, tripe palms frequently appear alongside malignant acanthosis nigricans, forming a powerful visual clue that something systemic is happening. Doctors recognize this combination as a red flag rather than a coincidence. The palms are responding to growth factors released by a hidden tumor, not to external irritation. Patients often recall dismissing the change as dryness or aging. Some switch soaps. Others blame cold weather or frequent hand washing. Months later, when digestive symptoms emerge, the earlier hand changes suddenly make sense. The skin was signaling long before the esophagus began to struggle. The practical response is awareness, not alarm. Sudden thickening of the palms, exaggerated ridges, and a velvety texture that does not improve deserve medical attention, especially when combined with risk factors like reflux or unexplained weight loss. Addressing the cause matters more than treating the surface. But even these dramatic hand changes are not the most visually unusual skin signal linked to esophageal cancer, because there is another pattern that spreads quickly and catches the eye in a very different way. Number 7, skin sign 3, erythema gyratum repens. Erythema gyratum repens is one of the most visually dramatic skin patterns linked to internal cancer, and it is almost impossible to ignore once it appears. The skin develops rapidly spreading red bands that form concentric rings, often described as a wood grain pattern. These rings expand quickly, sometimes over days, and they tend to migrate across the body. For many people, the itching is intense, persistent, and distracting. What makes this finding so important is speed. Unlike common rashes that fade or stabilize, erythema gyratum repens moves. The borders advance. The pattern changes. Topical creams offer little relief. This behavior is a clue. Dermatology literature recognizes this pattern as a classic paraneoplastic reaction, meaning the skin is responding to signals released by a hidden tumor rather than a local skin problem. Clinicians have long observed its association with cancers of the lung and gastrointestinal tract, including esophageal cancer. In several reported cases, the rash appeared before any swallowing difficulty, weight loss, or chest discomfort. Patients often sought care for the itching alone, unaware that the skin was acting as an early warning system. When the underlying cancer was treated, the rash frequently improved, reinforcing the connection. People often mistake this condition for eczema fungal infection or an allergic reaction. The difference is persistence and progression. When a rash spreads rapidly, forms repeating rings, and resists standard treatment, it deserves deeper investigation. Ignoring it can mean missing a critical window for earlier diagnosis. The practical step is recognition and escalation. Sudden onset, rapidly migrating ring patterns, and severe itching should prompt medical evaluation, especially in adults with known risk factors. Treating symptoms without asking why they appear delays answers. But even this striking skin signal is not the final warning the body can send, because there is one more finding that is rarer, quieter at first, and often appears when the disease has moved beyond its earliest stage. Number 8, skin sign 4, cutaneous metastases. Cutaneous metastases represent one of the most serious skin findings associated with esophageal cancer, even though they are relatively rare. These occur when cancer cells break away from the primary tumor and travel through blood or lymphatic channels to the skin. Instead of causing a rash or color change, they form firm nodules beneath or within the skin surface. At first, they may appear harmless, small, and painless, which is exactly why they are often ignored. These nodules tend to feel hard-fixed and immobile. Unlike cysts or inflamed follicles, they do not move easily under the fingers. The skin over them may look pink, light brown, or purplish, and over time they can increase in both size and number. Common locations include the chest wall, abdomen, neck, scalp, and upper back. Because these areas are visible or easily touched, patients often notice them incidentally while showering or dressing. From a clinical standpoint, cutaneous metastases usually indicate advanced disease. Large medical reviews in the United States show that fewer than 1% of patients with esophageal cancer develop skin metastases, but when they do, it often reflects wider spread beyond the esophagus. Many patients later recall that these nodules appeared before they understood the seriousness of their condition. The skin was quietly marking a turning point. The danger lies in misinterpretation. People may assume these bumps are insect bites, lipomas, or benign growths and delay evaluation. When a new, firm, painless nodule appears without a clear cause and continues to grow, it deserves prompt medical attention. Early assessment can clarify what the skin is signaling and guide next steps. The most important message is awareness, not fear. Skin metastases are uncommon, but they are meaningful. Recognizing them helps complete the picture of how esophageal cancer communicates with the body. But knowing these signs is still not enough on its own, because the real power lies in putting all of these clues together and understanding what they mean for you and the people you care about. As you reach the end of this lesson, the most important message to remember is simple. Your body often speaks long before disease becomes obvious. Esophageal cancer is serious, but knowledge shifts the balance back in your favor. You have now learned how risk factors build quietly, how symptoms can whisper instead of shout, and how the skin can act as an early messenger when something deeper is wrong. Seeing these signs sooner creates options, and options create hope. The safest and most powerful step you can take is attention. Pay attention to sudden changes that do not fit your normal pattern. Pay attention to your skin, your swallowing, and how your body responds over time. If something feels persistent, unexplained, or rapidly changing, seeking medical advice is not fear-based behavior. It is self-respect. Early evaluation does not mean something is wrong, but waiting too long can take choices away. You can also make changes starting today. Managing reflux, improving meal timing, reducing alcohol and tobacco exposure, and choosing foods that support digestive health all reduce ongoing stress on the esophagus. Small daily habits add up, especially as we age. These are not dramatic moves. They are steady protective decisions that support long-term health. Most importantly, you are not alone in learning this. This channel exists to help you understand your body, protect your health, and care for yourself and the people you love with confidence. If this video helped you see something differently, saving it allows you to revisit these signs when you need them most. Sharing it may help someone else recognize a warning earlier than they otherwise would. In our next video, we will explore practical nutrition and lifestyle strategies that support digestive health and aging well, with clear guidance designed for older adults. These are tools you can actually use, not theories. Please take a moment to save this video, subscribe to the channel, and stay connected. New lessons focus on medical knowledge, food choices, and senior health tips that help you stay informed and proactive. Your health journey matters, and learning one step at a time can truly change the road ahead.